Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Everyone, welcome back. This is Dr. Jacobs. In this video, I'm gonna go over the 3 most effective, powerful treatments to get rid and relieve plantar fasciitis pain. From my personal experience, I used to experience plantar fasciitis pain and plantar fasciitis symptoms 10 years ago, and those are the only 3 effective approaches that helped me to get rid of plantar fasciitis pain, and I'm currently pain-free for over 10 years, just following those 3 steps. Before I go over the 3 powerful treatments for plantar fasciitis, we need to understand what's going on internally. We need to understand the normal healing cycle so it will make sense how to treat it effectively to get rid of the root cause of the problem. So our body has to go through 3 stages in order to heal. I'm gonna use external paper cut for visualization, but the same process happens internally with plantar fasciitis. So the first stage of healing is inflammation, and that's when you start to have swelling, redness, and blood start to flow to that area and experiencing pain. Second stage of healing is a proliferation stage, and during this stage there's actually scarring here, as you see in the second image, fascia restriction, you start to experience muscle spasm and trigger points. Perfect scenario, actually during the maturation stage, our body gets rid of everything from the proliferation stage and the inflammation stage. Why scar tissue could be a problem? Because our muscle should act like a rubber band. When it contract and relax, should stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, it will not stretch much. And that's happened from the fibrotic tissue. As you see here, when you start to have plantar fasciitis, it's inflammation and fibrotic tissue in the plantar fascia here. So when you have chronic plantar fasciitis, usually you're not getting into the maturation stage and your body going back and forth between the inflammation and proliferation stage. And by definition, itis is inflammation. So there's always inflammation with the plantar fasciitis. But the problem is it's not only inflammation. So understanding the normal healing cycle, it will make a lot of sense how to treat it effectively. But before I go over the effective treatment, I will go over the non-effective treatment so you don't have to waste your time, your money on it, and actually make your symptoms worse, because some of these could cause more inflammation, more scar tissue, more fibrotic tissue, fascia restriction that will make your plantar fasciitis worse. So I will relate this to the normal healing cycle so it will make sense why these treatments are not effective. And also I will include the link for the research that shows those treatments are not effective based on the tremendous amount of research that showing these treatments either provide short-term pain reduction or no pain reduction. So ice and heat temporarily could decrease the inflammation, but it will not do anything for the fibrotic tissue, muscle spasm, and trigger points. And massage, it's like when you have inflammation, are you going to continue rubbing it, which actually could cause more inflammation, but it's not targeting the inflammation. Acupuncture, dry needle, the same thing, is not going to release the fibrotic tissue. Fascia restrictions, stretching is actually going to make it more worse, because based on a study, stretch, it could cause more inflammation, cause micro tear in the muscle, which is actually going to make it worse. That's why I disagree with the stretching. And you can see in YouTube, there's a lot of videos about how to stretch the plantar fascia, which does not make any sense because it's going to make it worse. Strengthening exercises, more effective than that is function training. But when you start to introducing a strengthening exercise during the inflammation stage, you're going to cause more inflammation. So to get to the root cause of plantar fasciitis, we have to break this vicious cycle. So the first effective treatment is getting rid of the inflammation that happened internally here. And what I personally do for inflammation, for acute stage of plantar fasciitis, rest should help to decrease the inflammation. So if you experience plantar fasciitis and in 2-3 weeks after resting resolved, that's mean it's a minor case of plantar fasciitis. But if you notice as time goes on, the symptoms increasing, that is chronic severe inflammation. If the symptoms not decreasing, that the rest will not be enough. If it's decreasing, it will be enough. But we have with chronic plantar fasciitis to break that vicious cycle, to be aggressive on decreasing the inflammation. So what I personally do with myself and my patient, decreasing the inflammation with Magna Heal 2. Magna Heal 2, very strong magnet. The magnetic range around 3 to 4 inches that penetrate in the body. I have patient wear it inside the socks and sleep with it to decrease localized inflammation. So it's very important for plantar fasciitis to decrease internal inflammation. Simultaneously, we have to decrease body inflammation. And I usually like to put my patient on an anti-inflammatory diet, because there is several food that cause internal inflammation and slow down the healing cycle. So simultaneously, I work on localized inflammation, at the same time decrease internal inflammation with anti-inflammatory diet. And for the patient that has chronic plantar fasciitis, that their body's going back and forth between inflammation and proliferation stage, I have noticed those patients have a lot of issue with deficiency in several vitamins, mineral, that could slow down the healing cycle. For example, you need D, magnesium, B, C, and other vitamins and minerals for the body to transition from inflammation to proliferation stage to maturation stage. But if you have some deficiency, your body gonna stuck between inflammation and proliferation stage. And that's why I like to do extensive nutrition evaluation with the patient to get to the root cause of the deficiency that slowed down the healing cycle. For plantar fasciitis, we cannot assume just working on the inflammation stage will resolve the problem, because as you see in a chronic condition, there is a vicious cycle between inflammation and proliferation. So we have simultaneously to release the adhesion that occur here from the micro tear of the repetitive strain injury or poor posture, poor body mechanic, or bad gait, to really release the adhesion in here so the pain will be subside. So in order to do that, we have to get rid of fibrotic tissue. And as you can see in this image, the first image here, this is normal muscle. There is no issue in this muscle. When you start to have a tear, you can see the tear here. The normal healing process, your body gonna build fibrotic tissue to glue that tear, to put it together. So it's very essential for our survivor to have that fibrotic tissue, but too much of fibrotic tissue cause the symptoms. And if you palpate in your plantar part in here, this area, and I notice it with the tools I have, actually, when I palpate on the plantar fascia, I can feel the fibrotic tissue. It's like little sand or rock. And when you stand actually on the plantar fascia, pay attention and you might feel that there's something pushing on the plantar part, and that's the fibrotic tissue. As you see, it's disgusting and it's in the way of other tissue. And if we don't release it, inflammation by itself not gonna break that adhesion. So simultaneously, we have to release the fibrotic tissue while we working on the inflammation. So what I personally use for the breaking the fibrotic tissue is A3 to release the fibrotic the fibrotic tissue superficially, and then I use the A5 to go deep enough to break fibrotic tissue and deep adhesion. And I will leave a link for these tools underneath this video. So the other thing, the third treatment that has to be done simultaneously is the fascia system. So when you have fascia restriction, the fascia system, the superficial fascia layer, it's like a wrap surrounding the entire body. It's like a Spider-Man suit. When you have fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small. By definition, plantar fasciitis, inflammation in the fascia of the plantar. But when we look at the plantar fascia, there is a lot of fascia layers here that has to be released. So next time when you go buy meat, look at the white filament. That's the fascia layer. To make things complicated, the fascia system is divided to two major categories, superficial and deep fascia. But don't worry, the treatment is very simple. So the deep fascia layer is actually divided to 4 subcategories: apoptotic fascia, epimysin, premiysin, endomysin. And as you see here, that those layers, it's layer wrapping the entire muscle, another layer wrapping a group of muscle fibers, and then individual muscle fiber has fascia layer wrapping it. So when you have fascia restrictions, it's like you're wearing t-shirt 2 to 3 size too small. We have to address that simultaneously, especially when you have fibrotic tissue. That fibrotic tissue glue those fascia layer together, so it make things more restricted. So we have to address the fascia layer simultaneously. So what I personally do is I use the A1 to release superficial and apoptotic fascia layer, and I use the A5 to release the epimysin, premiysin, and endomysin. In order to get to the root cause of plantar fasciitis, we have to address the vicious chronic condition, vicious cycle of inflammation and proliferation simultaneously. You cannot pick and choose. I'm gonna work on inflammation and I will not do work on fibrotic tissue or fascia restrictions, because the treatment will not work, because the problem is inflammation and fibrotic and fascia restriction, because the problem contributed to inflammation, fibrotic tissue, and fascia restriction that cause the pain and the discomfort when you put weight on your feet. If you have any question or comment, leave it in the comment section below and I will answer it in a future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.